So I'm a third generation primary care doctor, with my grandfather being a primary care doctor and then my dad being a primary care doctor. I grew up in my parents' office kind of seeing my dad, do traditional primary care. He knew all of his patients. He had the same patients for over 25 years. He knew about them, he knew about their kids. My specialty is family medicine with fellowship training in sports medicine, and I'm one of the doctors in the concierge clinic with Cleveland Clinic. Family medicine uses a lot of something that we call functional medicine, where a lot of the time we try to figure out what is the root of the actual problem. Concierge medicine, it gives me the time to spend really learning the patient, really understanding what's important for the patient, what is the patient's goals, how can we achieve these goals, how can we get there sooner. I can go through the medications, go through their history. And one of the big things for me is I like to go through all of their preventative evaluation. Prevention is key. And so we're able to sit down, we're able to talk about, when was your last colonoscopy, when was your last mammogram? And that's one of the other big things that I think that Cleveland Clinic is doing because of the medical records with the Epic. If someone is coming to us from Boston and I need to go talk to Mass General or reach out to them and find some previous imaging, it's very easy. So we're able to kind of go on the computer, I'm able to find what I need to do, I'm able to update my records. And concierge medicine, it gives me the time to spend really learning the patient, really understanding what's important for the patient, what is the patient's goals, how can we achieve these goals, how can we get there sooner. We're also seeing the patient not only in the clinic, we're also seeing them in the hospital. So if one of our patients is hospitalized, we go to the hospital, we talk with the hospitalist, we talk with the ER doctor, we talk to the nurses, we talk with the specialist, we try to see, hey, this patient has good follow-up, I could take over when they leave from here. And I think it makes a big difference. I love helping patients. I think it makes me feel great. And when I'm done here at the end of the day, and I feel like I've talked to someone and I've been able to make a difference, and this area has been amazing. The people are friendly, we like going to the beach here, we like going to the restaurants, we like talking to everyone in the community.